It's happening.
I'm so excited.
I know, me too. We've talked about it, and now it's like a real thing. This is going to be like put out there
in the universe
for the masses.
Everybody to see.
Yes. You and me, Anna.
I know. We go way back.
I hope people listen.
I hope so too.
I think they will.
A
dozen or two.
Yeah.
Well, this is Skincredible.
Incredible.
Skincredible. What a great name.
It is.
Whoever thought of that name.
Smart.
Pretty genius.
Yeah. And funny.
It was me. It was me. Because what this podcast is, Miss Anna, is a talk about how incredible our skin is and a talk about credible information about your skin or your child's skin or your uncle's skin. Anybody who has skin could get something from this podcast. So if you're a reptile, sorry, this is not for you. This podcast is not for you. But if you're a human being with skin, listen up.
Listen up.
Listen up. You're going to learn some stuff. You're going to have a good time. And your life is going to be better because you're Skincredible.
It's true.
Yeah.
I just noticed that your toes are showing because the preview doesn't show us that, but now it shows it's because your feet were up.
They were up. They were up.
So we can start over if you'd like.
No, I think it's good. Let's leave it. You know, we're human beings.
We are, yes.
This is our first recording.
We're trying, yeah.
It can't be perfect the first time.
It's not relatable.
No, that's not relatable. And so this is almost an intentional mistake just to show the audience that
this is us.
We're human.
Mm-hmm.
This is us. This is our first time.
It's true.
And I have feet.
Yeah, it's good to know.
Yeah. So I think it humanizes us. And I think people are going to get a kick out of it. But for now, I am going to keep my feet down.
Okay.
They were comfortable on that little ledge, but knowing this now, they're down.
Okay.
Yeah.
I love this.
Yeah.
So we were talking about the reptiles. They have skin too.
Well, it's different. It's scales.
Scales, not skin.
No, so I don't think they'll be our viewers. Okay. I don't think we're going to get many snakes and lizards listening to this. Which is a shame, but there are billions and billions of humans with skin that I think will really gravitate towards this.
There's a lot out there. How do you listen to the noise and know what to actually give importance to?
Right, exactly. And so, you know, when we were talking about this and like doing a podcast, I wanted to get good information out there. I love dermatology. I love pediatric dermatology. I love talking about pediatric dermatology, and I wanted to share that enthusiasm with the people of the world. And I wanted to share helpful, safe information because there is so much noise out there. And I hear about it every day in clinic. People coming in for this and that concern. And, you know, they've referred to several resources, which is mostly Instagram and TikTok. And I just found myself having to devote so much time to just discussing what they had already read.
Yeah.
And I was like, I want to do something more to help combat this.
Yeah.
And I know a lot of dermatologists will try to combat misinformation by getting more active on social media. That's not entirely my jam. The pod will have a social media presence, but you, my lovely Anna, will be managing that with, you know, brief appearances by myself when necessary, because social media, that's just not been my thing. A podcast could do what we want it to do, could put that good stuff out there. There you go, Skincredible. And so here we are. We had an idea. And we've developed it, and now we're recording. It's reality. Do you think the audience would appreciate knowing more about me?
Of course,
and like,
yes.
Why I feel like
why do you love
I'm Skincredible and why?
Yeah, you are Skincredible.
Skincredible,
and your skin is incredible.
Thank you. So I am Lisa Swanson, and I am a dermatologist and pediatric dermatologist in Boise, Idaho, land of potatoes. Any potato sponsors out there? Yeah.
Hit us up.
We would love to talk to you.
Yes.
Because I love potatoes. I commonly like to say that in this divided country that we live in, everybody can get behind a pro-potato stance, right?
That's right.
Right?
Fried potatoes?
Fried potatoes, whether it's like French fries or mashed
Yeah.
potatoes or sweet potatoes or tater tots.
There's a potato for everyone.
There's a potato for everyone.
Yeah, it's true.
I see primarily kids. That's kind of my jam. And I love talking about pediatric dermatology. I do a lot of lecturing at conferences, and I just love it. I live and breathe it.
You do,
It's
and you're
my
really
thing.
good at it.
Thanks.
The kids love you.
Thanks, Anna. Thank you.
Yeah.
I think it's because I'm short.
You
know,
know,
like I'm
you're
at
one
their
of them.
level. Yes. It's quite embarrassing when I see like the 12-year-old
Yeah.
that stands up and he's like 6 inches taller than me. And I'm like, oh my gosh.
I'm sure there are some perks to being short.
Right. There are. I'm still trying to find them, but there are. I guess we can squeeze in small places.
Yeah, you're like more inconspicuous. I
Right?
feel like when I show up, I'm just like everybody knows I'm there.
Yeah.
I'm like,
I also really try to enrich my words to speak to a younger generation using words like bussin'.
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 What does that mean?
It means like awesome.
Okay.
Like that's bussin'.
Okay.
No cap.
No cap. That
Yeah.
means
Like
it's
no
real.
lie. Like
no
yeah,
lie. Yeah.
Yeah. I heard one recently.
Okay.
About like if you're complimenting somebody,
Okay.
you are putting the glaze on them.
The glaze, like a donut.
Like a Krispy Kreme donut.
We like it.
So I really try to keep myself current and speak the language of my patients.
Yeah.
I also watch a great deal of Bluey.
Bluey, we love Bluey.
I mean, we love Bluey. If anybody out there, I know we've got the whole Healer family right there. If anybody out there is living in Australia and tuning in, I love Australia. I studied abroad there in college.
You did.
It was amazing. I was in Sydney.
Wow.
I lived in Coogee Beach. Holla out to Coogee Beach. It was amazing. It was the closest I've ever lived to water in my life. And Australians are so friendly and so wonderful. And so I already love Australia. And then this Bluey show comes out. I love dogs. I love Australia. It's funny. It's cute.
Short.
And so, yeah, episodes are just 7 minutes. And so I like to quote Bluey too.
Give us your best Bluey quote. Your
I
favorite.
can't pick just one.
Pick two.
So in a pickle.
In a pickle.
We're really in a pickle
Really
now.
in a pickle.
I love that. I love when Bingo says that she's busting. So when Bingo has to take a wee, and she asks her dad, "Dad, I have to take a wee," and he says, "Bingo, can you wait?" And she says, "No, Dad, I'm busting."
So cute.
So cute.
So cute.
And they call toots. They call them fluffies. I mean,
Can't
come
get
on,
any cuter, yeah.
right? And so when I'm talking to a littler kid, I'm quoting Bluey like crazy.
I love it.
When I'm talking to a teenager, I try to bring out some, hip slang.
Yeah, of course.
And just try to communicate on their level,
Yeah.
Yeah, speak
You're
their
good at that.
language.
Yeah, you never make patients feel like they don't know enough or like they
Right.
can't relate to you somehow.
Yeah, I try. Sometimes the teenage boys are hard.
Sure. For everybody, not just
Yeah.
for you. I volunteered with teenage boys and I was like, oh, it just seems like they don't really like anybody
Right.
sometimes.
Yeah. Sometimes it can be a little bit harder to coax them out of their shell.
Yeah.
But I keep trying.
Yeah. Good.
Yeah, I keep trying.
Good.
Yeah. But this way, I get to speak to everybody.
Yeah.
There are just over 400 pediatric dermatologists in the entire country
Whoa.
of the
That's
United
not
States of
very
America.
many.
No.
Wow.
There are still 7 states without one.
Whoa.
Yeah. And so a lot of people out there don't even have access or opportunity to see a pediatric dermatologist for their child or their teenager. And so I really like to try to get that knowledge out there, educate the community,
Yeah.
and just put some good stuff out there. Again,
Yeah.
we're coming
just
back. I'm
general
coming back to
goodness.
that.
You're
Yes.
a goodness lover.
I am.
Yeah.
Goodness, kindness.
Yeah.
One of the 2 things that I hate is meanness.
Yeah.
The other one is salad.
Salad.
Yeah.
Oh, that just took
Yeah.
a turn.
Yeah.
Okay.
Yeah. Yeah.
Yes, meanness and
Meanness
salad.
and salad.
Okay.
Those are
okay.
my 2 dislikes. Yeah. Yeah.
They're fair.
Yeah, right?
Yeah.
Right? I
Potatoes are
mean,
better.
yeah, right? Although in Pittsburgh, it's either
Mhm.
Pittsburgh or Cincinnati, they put French fries on salad as like,
And that still be considered a
and
salad?
it's still a salad.
I love it.
So it's like a salad, and
creative.
then they just like toss some French fries on
Let's
there.
do it.
Yeah, yeah. And so I can support that.
Yeah. Get
Yeah,
behind that.
I can wrap my head around that kind of
Yeah.
salad. Yeah, yeah.
I like it. You've been a pediatric dermatologist for how long?
Oh, that's a very good question. I have been a pediatric dermatologist for 15 and a half years.
It's a long time.
A lot of people might not know like the road
Yeah.
to being a pediatric
Tell us
dermatologist.
about it.
So you go to college,
Mm-hmm.
and then you go to medical school, and then you do an internship in kind of usually like general medicine stuff. And then you do 3 years of residency in dermatology, and then you do a year fellowship in pediatric dermatology.
Which dermatology is hard to get into as it is, no?
Yes, it is one of the more competitive specialties because it's awesome.
Yeah.
And everybody wants to do it. But yeah, and so that was scary because in medical school, I saw classmates that had their heart set on a competitive specialty, and you can just get so competitive and caught up, and that's just not me.
Yeah.
And so I was like, I'm going to just do the best that I can and let the chips fall where they may,
Yeah.
and hope that everything works out. Unfortunately, it did. I knew that I wanted to be a dermatologist pretty young because I had an awesome dermatologist growing up, and she saved me so many times. And I would just go to see her with a problem, and she would just look at it and know, and she would start me on treatment that worked. And I was like,
Magic.
this dermatology stuff is awesome.
Yeah.
And our ability to fix things that our patients come to us with has only increased exponentially during my 15 and a half years of practice. We can help patients more than ever before. And that's really exciting.
That is exciting.
Yeah.
Hopefully there's a patient out there who's going to be a dermatologist because of you.
Oh my gosh.
How cool would
that
that
would be
be?
so cool. Oh, that would be great. You could come, I mean, come rotate with me,
Yeah.
learn how awesome it is because it really is very special. The skin, whenever there's an issue with your skin, that's an emergency, And even speaking as a dermatologist, I dealt with a bad rash myself personally a few months ago. It was awful. It was awful. And I'm a dermatologist.
Yeah.
But maybe that sometimes makes it worse because
Sure.
like my rash was on my face, and nobody trusts a dermatologist with a rash. And so it's like, I got to make this better and fast because people are looking to me and thinking, gosh, I'm not going to take her advice if she's dealing with this. But I just felt like I couldn't get it better fast enough.
Yeah.
I reached out to friends because, even when you're in medicine, it's difficult to treat yourself. You lose some of your objectivity. So reached out to friends and just had a newfound, I try to keep my empathy alive all the time, but bursts of dealing with things like that, my empathy came back big time.
Yeah.
During that period of time, if I had a family or a patient that called in for a rash and needed to get in sooner, I was like, you get an appointment. You get an appointment. You get an appointment.
I'll work all hours of the day.
I'll stay here all night until I fixed all the rashes in Idaho because it makes you miserable.
Yeah.
And it's so unbelievable just how quickly you lose your confidence, you lose your sparkle. And we can help fix that for patients, which is really a superpower.
Yeah. It's life-changing for people.
Yeah.
Yeah, I remember when my acne was cleared, I'm like, you're a whole different person.
Whole different person.
You're just like, I want to go out. I want people to see me. I'm not afraid anymore.
Exactly. Yeah. And like, for the kids I see, they might be covering up their rash.
Yeah.
They might not be going to sleepovers because, maybe in their PJs, somebody might see their rash.
No swimsuits.
No pool. They're self-conscious if they're itchy or scratchy because, people out there are like, is it contagious? You feel like you have the cooties.
You hear patients say like when you're flaky, you wear certain clothes so that, it doesn't show the flakiness.
Right. Yeah. And so it's so fun in clinic because you see a kid or an adult for that matter
Yeah.
that comes in and is kind of a shell of themselves. And then you fix their skin problem and lo and behold,
Blossom.
yes. And some parents have told me, if their kiddo has bad eczema is a great example because we've had so many wonderful therapies developed for that. They see their kiddo with eczema, they go on this medicine that treats their eczema so wonderfully and so completely. And they come in and tell me, I feel like I'm meeting my kid for the first time.
Oh,
I mean,
that's special.
yeah, because the child was tethered by their skin disease and making certain choices about their activities that they participate in, even hanging out with friends after school. And now with their skin better, turns out they like soccer.
Wow.
But we didn't know because they were afraid to wear the shorts and the short sleeve shirt. They love to swim, but it burned their skin before.
Yeah.
And so they just wouldn't do it. And so we are going to be talking about so many wonderful stories like this during the pod, Anna, because for the listeners out there and the viewers out there, what this pod is going to be about, we're going to have episodes that are talking about a certain skin disease. So there'll be one episode dedicated to just talking about that skin disease. What is it? What causes it? What are the implications of it?
In terms that everybody can understand.
And then we're going to have episodes where I talk about the treatments available for those conditions. And then we're going to have episodes featuring patients.
Real live patients
Or their parents.
Yeah.
Depending on their age.
Of course.
Babies don't talk much.
Yeah,
So if we're talking about a baby story, we're going to have a parent. Yeah. Otherwise it'd be a pretty boring podcast.
Yeah.
Me just asking the baby questions.
And no response.
And the baby's just like, goo goo gaga. And so we are going to be educating people out there by utilizing real patient stories.
That's exciting.
I heard Oprah say once that her television show was so successful because it offered information with inspiration.
I like that.
Right? And that's what I'm kind of after. That's the vibe.
Yeah.
To use a young person word.
Young people out there.
Young people out there, we're vibing. That's the vibe I'm looking for.
Yeah.
Information with inspiration.
That's beautiful.
Yes.
I think we can achieve it.
I think so too. Yeah. I feel like we already have.
Yeah.
A little bit. I think anybody tuning into this is like, this sounds awesome.
That's right.
And when does the next episode drop?
Waiting.
Yeah.
Already.
Now, I wonder if we should tell the audience where you came from.
Where did I come from? I mean, how you and I got connected.
Yes. Like I told my dermatology story.
Yeah.
Where does Anna come in?
We met when I was 20 years old. Isn't that crazy?
Yeah.
I mean, I guess we're not talking about ages. We don't have to disclose too much.
No.
We look just the same.
No, we're not mentioning how old I was when we met.
No. But we've known each other. Would that be the whole time you practiced dermatology?
Yes.
Yeah. So I was hired as a medical assistant in preparation for you and another physician to join the practice. And this was back in Colorado.
Yeah. Maybe we should tell the audience I practiced in Denver for 10 years before moving to Idaho 5 years ago in 2020. Exactly. And so we met back in Denver.
We did.
Yes.
And we've had a connection ever since. It all started by dog sitting, I think.
Yeah.
Because I wasn't your direct medical assistant at the time.
No. But you were my dog's auntie.
I was.
Almost immediately.
Yes. Yeah. And so that was kind of how we got connected. I started dog sitting for you, and then we just became good friends over the years. I think we just really learned to trust each other. And then I followed you to Idaho at some point.
Yes.
You're my like a gateway to Boise.
Yes.
I don't think I would have ever heard of Boise had it not been for you.
I know. You're not alone in that.
Yeah.
But Boise's a gem. Yes. It is a hidden gem, don't you think?
Yeah.
Yeah.
Not everybody needs to know, but
some
people
that's
need
true.
to know.
That's true. Never mind. Boise isn't that great.
It sucks.
It isn't that great. We definitely don't consider it.
Yeah. No, it's really great. And people are still like, how's Iowa?
Yeah. The Idaho-Iowa confusion.
It's so funny.
It's insane.
Totally different, but it's okay.
I'll be in Chicago for a conference.
Yeah.
And people will be like, oh, did you drive here? And I'm like, no, because I live in Idaho. And it's all the way over by Washington,
It's pretty
and
far.
Oregon.
Yeah. So funny. It's so pretty here. And that's how we know each other. And we've just, been friends ever since for a really long time. And now we're both enjoying life in Idaho.
Yeah.
And it's the best.
Yeah.
We're pretty lucky.
Yeah. And for all you listeners out there, Anna is a superstar. She's very humble. She's very humble. So she's not going to say that herself. But she's a superstar. I always knew I could trust her with any task, doggy or dermatology related, any task. She could do anything. And now you're an executive producer of a podcast.
It's exciting stuff.
Yeah.
So here we are.
And so, I would kind of vent to you about all the stuff I hear in clinic.
Yes.
About the things people have learned online. We've just tried to brainstorm and how to launch a misinformation campaign and try to set things right-ish and get reliable, good info out there. And I think this is going to be great. Yeah.
It's going to be good for the people.
Yes. Good for the people.
We're excited for everybody to join us.
Yes. And so now you know me and you know Anna Prieto.
That's right.
And you know Skincredible.
Yes.
And now you have an idea of what you're in for with this podcast. We're so excited for you to join with us on this journey. And just wait, there'll be more episodes dropping, and you'll get to learn about skin stuff, and you'll get to learn about treatments, and you'll get to hear from real patients.
That's right.
That's where the joy is.
We can't wait.
We can't wait.
The adventure begins.
Yes, it does. Thank you guys for tuning in.
Thank you.
Keep watching.